Hi guys, it's JDad1. Good to be back with you again. It's been a long time and I haven't heard from anybody for quite a while. I've been busy doing other things. But I was just thinking about some stuff, and I'm going to start doing this a lot more. One of the things I want to take you to, and it's good to be back with everybody too. I'm glad to be talking to you instead of like dead. Who knows? I'm glad the friggin' world hadn't ended. Who knows what could have happened. All this stuff that we get caught up in, huh? Anyways, what I want to talk about is buprenorphine. It has now been approved for pain medication, and it's still Schedule 3, so it can be called in from the doc, but the doc has to have a special license to be able to prescribe it, which makes it kind of difficult, and plus it's very expensive. It's probably about $400 a month for 120 of them. If you can get your doctor to prescribe that many. That's about the max you can get of the 8 milligram sublinguals. But now what the DEA and all has approved for pain is an injection, which is way more than the pills, but it's in a less dose. But you know it's going to be still expensive. And good luck getting your insurance to get you hooked up for it, because they ain't gonna pay for it, because it is. They'll claim that it's used to treat drug dependency from painkillers and stuff like that, because they have absolutely gone to war with painkillers. You know, pain medications and stuff like OxyContin, stuff like that. Doctors are scared of. They're getting arrested. They're getting thrown in jail. People are overdosing on it, and they're abusing it. So they've turned to Subutex, Suboxone, and the FDA has now approved it for pain. Like I told you guys it would. I told everybody where this was going. Now there's a small-time pharmaceutical war with the Subutex, Suboxone people and the narcotic Percocet, Percodan, OxyContin, those people, okay? Because it's a different type of drug. You don't feel like absolutely like you've got the freaking worst flu of your life when you run out of Subutex or Suboxone. But you're still going to have your pain and, you know, all that stuff. But you're not going to be so sick that you can't go to work. Plus, it's very expensive compared to the cost of the other ones. The other ones have been around so much longer. My suggestion to anyone is, if you can afford it, and if you're not that serious of pain, use Subutex or marijuana, whatever you can get. But if you can't, you know, take the other stuff. Take the opioid. And Subutex is an opiate, and others are opioid, but it's more addictive. Personally, I'm just going to go for the good old, if I have to, you know, roll me some poppies. Make tea out of it or something. Who knows? There's many possibilities with that right there. But that can also be, you know, addictive if you get out of control with it and you're drinking it like sweet tea. Wouldn't be a good thing. But anyways, here's what the DrugsCon talks about it. They actually say it lasts way longer than it really does. There's a picture of a couple of them. This is buprenorphine right here. It doesn't last nearly as long as they say for pain, but it does have a very long half-life. So if anybody thinks that they're going to take one of these pills and party for the weekend and then go to work and not get popped on a urine test, you're freaking crazy. Because it's going to like take at least a week for, if you just took a few pills, for you to get out of your system. I mean, it stays in there for a long time. But the good thing about Subutex is, if you was in an accident or something, they could give you, you know, something else at the emergency. They'll give you Dilaudid or something there. But now the doctors and all who write Dilaudid and OxyContin and all the other pain medications are getting very hard to find and very expensive as well. Most of them only take cash. They don't mess with the insurance companies, because it seems like those who mess with the insurance companies get shut down by the FDA. So, you know, it's a big deal here going on with this stuff. like I told you that it would, and where it was going. Oh, by the way, guess what? Don't show that again. I don't want that there. Guess what, y'all? I don't have to tell anybody the pain medications disappeared from the streets big time. A lot of people can't find any, but heroin is friggin' everywhere. Anybody can get heroin just about. It just seems like it's just been dumped on us. And I told y'all that was going to happen as well. And we're having a lot of deaths and a lot of stuff because of that. Because I found out personally that oxymorphone was nothing but heroin, except in a very pure form, made in a lab by pharmaceutical companies that holds to a certain degree of standards. But because I took a urine test for my doctor, and the nurse was showing him that it showed for heroin, but he knew it was oxymorphone. But he just shook his head like, oh, that's no problem. He didn't tell me, though, what the frack was going on. But found that out, which was surprising to me in one way, but then in the other way it wasn't, because when I ran out of it, man, I was fracking sick bad. Sick bad. You don't want to get dependent on this medication if you can help it. But there is a perfect cure for that. And that is buprenorphine. It's excellent. You won't go through any withdrawals you may go just a touch before you have to before you take it. But and it'll help your pain go down too. But if you're addicted to medicine, and don't keep getting sick, man, get some buprenorphine. Because it'll get rid of all that crap. Now, the other thing about it that I need to tell you is if you take buprenorphine, it's going to take probably a week before you're going to feel a Dilaudid real good or something like that. You're not going to hardly feel that unless you take a huge dose, because it's a partial pain receptor agonist. So, But yeah, here's some press announcement. The FDA approves first for buprenorphine implant for treatment of opioid dependency, which is not just true, but for dependency and for pain. Everybody wants to talk like the stuff is, oh, painkillers are so bad, and they have really demonized that kind of thing. Having to take pain medication and stuff. People will talk trash about you. They will talk bad about you. And, some pharmacies won't even fill prescriptions anymore. But they won't even look twice at somebody who's drunk or drinking or having to visit the liquor store every day, which is also a huge strain on your liver and your health, and can get expensive too. But beer is everywhere. It's easy to get. 7 days a week with no prescription, no control, no nothing on it. And it kills more people every year than this stuff ever did. Because most of the people that died of an overdose of pain meds died because of the complications with alcohol, which they were consuming alcohol at the time, which triples the effect of the narcotic. So, if you want to tell me if somebody died of an overdose, look and see if they were drinking. I'll bet you 9 times out of 10 they were drinking some alcohol with it. They were, trying to kill the pain, mentally, physically, whatever. Or they were just trying to party and have a good time. But you should never drink taking this stuff. If you're going to drink one beer or something, that's it. And then wait about an hour and see how you feel. Oh, this is hysterical that they're showing Dones up here when I wrote pain medication. That's freaking fun. Tylenol's funny too. Unbelievable, huh? Anyway, I wanted to get this video out there, shoot this one out there, because I noticed they kind of didn't like my other video that I talked about Subutex and how it's nothing but another freaking same game as the other game. Meet the old boss, same as the new. Or meet the new boss, same as the old. There you go. Meet the new boss, the same as the old. Same thing. You're just trading a few different things for it. You're going to have a hard time finding a script of OxyContin or oxycodone, 30 milligram, 15 milligram, whatever, because it's Schedule 2. And doctors are scared to death now of Schedule 2 narcotics because so many has been thrown in jail and arrested for overprescribing Schedule 2 pain medication, which is bull crap in my eyes. They have the license to write antipsychotics? You got to be kidding me. They ought to be able to write you for frickin' heroin if you need it. And that's just how it is. Antipsychotics are way more dangerous than any kind of pain medication ever thought it was. But, do some study. Know that you're going to have to really watch yourself. If you start getting out of control, man, go to buprenorphine. Because don't get yourself in that life, because it really can suck, and it costs work days, it'll cost sick days, and a lot of unnecessary sucky days in your life. So if you need to take medication for something like that, and it's not the kind of pain that's the only way you could control it, because there is that kind of pain out there that there's only one way to treat it, and that's with heavy doses of narcotics. I mean, just face it, y'all. And that person's not sitting around getting high. They need the pain relief. They must have it, or their body might not be able to deal. I know that happens. People that are living in serious pain and getting no relief die way younger than those who get relief their whole life through. But, shoot, when you get into OxyContin, that's expensive too. So there's buprenorphine, and it has been approved for use for the management of pain. Oh, yes, I was telling you, good luck getting your insurance to pay for it, because they were going to have your doctor approve it for narcotics substance abuse, which you might not want that on your record either. But if you got a good doctor, they'll just push it through and say, yeah, we need to get him off the other stuff. They'll write it to him. But the thing I found out, like my insurance company did to me, is they made it to where I couldn't get it because it was the name brand medication. Even though buprenorphine is the chemical version of it, there's not enough people out there that make it to give a good a good alternate in the form of a generic, even though I think buprenorphine is the generic form of it, because there's more than one out there. But they won't give it to you because it's just expensive. It's super expensive. I mean, $400 a month. But the one good thing out of it is, though, guys, if you have to, you can get a good pharmacy, and if you have to eke out a couple of pills every day or two, they'll do it for you. And I mean, that's like $15, $10, but they'll do it for you, and that can help a great deal sometimes. Now, I've heard Walmart sells them for $4, but I don't know that that's true, because Walmart wouldn't even, they tried to get them in stock, and they couldn't get them in stock. See, what's happened with me is I've had to, I could not continue to go to my other doctor for pain management, and because it was getting so expensive. I mean, it was getting very expensive. It was getting to be $400 a month, and then my, insurance is $400 a month, and then the prescriptions are, at least $50 to $75 a month, and the freaking gas. I mean, it gets expensive, guys. So find you a doctor that's been that's gone through their little course for being able to prescribe buprenorphine. And oh yeah, by the way, they're now seeing that fracking buprenorphine is being used and abused just like, you know, just like the other. Let me open this up for you here. Yeah. But, you know, like I say, it's a good thing to do instead of not be able to do nothing but suffer, because that sucks. Let me see here. Here's a brief guide to select common painkillers I've got for you. Here's a vial of tramadol. Yeah, tramadol. Abusing pain-killing prescriptions. All these states, they say they're the worst. These up here in the super red. Utah, and I guess, what is that? Oh, shoot. That's huge, you know, huge population. But, yeah. And this is an old chart, so that's gone way down, because it's so hard to find. And you're not going to get it. And just, you know, you're not going to get it like you think you will. And if you do, it's an unusual thing. If you can find a doctor to continue to prescribe you that's not going to charge you $300 a visit, and then make you go to other doctors that they're kind of, you know, shaking hands with, friends with, giving them a kickback, because they'll send you to another physician just to back them up. I mean, it takes that much protection for them to write you the painkillers. It almost takes 2 doctors to do it. And, you know, your pain management doc running you for 6 months, and then they got to send you to this other doc, and he only takes cash, and they funnel patients back and forth. So that's the deal, and it can get expensive. So do what you got to do, guys. But I hope everyone's well. You know, do what you got to do. If you got to take something, take it. Oh yeah, it's the new injectable kind, but there's a way that you can take the pills and make them into injectable form too. If you do some research on it, it might save you some money there. So, but be careful, know what you're doing, and study up. You know, be safe. Don't be stupid. But yeah, man, if you're in pain, you know, back pain, neck pain, all kinds of pain hurts. Even pain that's not real hurts. You know, it doesn't really matter. Pain is debilitating if it's continuous. Now, pain that comes and goes isn't so hard to handle. But the pain that's constant and that's always there, that comes with injuries or disease, is tough to deal with without some help. I mean, there's times you're just going to have some relief, because you don't sleep, you don't want to eat, your life is just sucks. I mean, it sucks. And you feel like, you know, it's not worth living. But take the choice and do the right thing, study up, and take you some freaking medicine, man, and choose to live, because it can really, you will be amazed at how much better you will feel. But just know this: if you take OxyContin or oxycodone, and you're having to take a lot of it for pain, when you run out, you're going to feel like crap. If you're taking buprenorphine, you're going to hurt again, but you're not going to feel like crap, okay? You'll be alright. You'll live through it. I mean, you'll live through the other two, but it will suck. That first week will feel like a daggum year. I kid you not. But anyway, I hope everyone's well. I hope I've brought you guys some good information. I wanted to get to, this is what the DEA says about buprenorphine, and I want to show you right here. It is approved for pain. Buprenorphine and Suboxone, 2001, 2005. Treatment Act was amended. Where's this thing at? Oh. Here it is. Buprenorphine is intended for the treatment of pain and opioid addiction. Or in some people's cases, maybe just party a little bit. Who knows? You know? But anyway, this is the DEA official thing for it, you know? But people are abusing it. People are doing all kinds of things. There's a thing, a little pack of, looks like 5 of them. Little injection, disposable vials. And you can, you know, it's IM injections or IV. And it's a very low dose. I mean, I think it's like not even a milligram. I think it's a half a milligram. Maybe it's something like that. Maybe it's a milligram, but it's not a lot. I mean, it's not nowhere near what they think it needs to be, or what it really needs to be, as far as I'm concerned. As far as I'm concerned, if you're getting an IV, for IV use, you need probably at least 4 milligrams of it to get good effect, as much as you're going to get for pain control. And sometimes, in some cases, you can use it in conjunction with other narcotics if you've got a really, really severe injury. I mean, like if you're severely burned and you've got to be in the hospital for 6 months, tell them to put you on buprenorphine and frickin' Dilaudid, you know? I mean, there's a good combination. And they can cut you off the Dilaudid and you won't go through hell. And then you'll go home with a little prescription and have as much of a good life as you can. But if you need the medicine, take it. Because I'm sick and tired of people acting like other people who've got to take meds are trash, or they're scumbags, or something like that. I've seen a lot of that. People who think they're better than others. But that's only the people that I've come to find out. Those people have never had a major issue with pain, or they've never had a loved one with a major pain issue. And as far as I'm concerned, man, if somebody says they're hurting, they're hurting. So, help them, doctor. Yep, doctor, don't give them no tramadol. I mean, if it helps, give it to them. But if they say, hey, I need serious narcotics for pain, please help me, give it to them. What's the big deal? They now have buprenorphine that can keep you from being in severe withdrawal. And any doctor that tells you you're just going to have to dry out and go cold turkey, they're full of crap. And they want you to suffer for 3 days to learn a lesson or whatever. And I think that's stupid too. I think any doctor that does that's a freaking immature jerk. And he ought to be ashamed of himself. Anyways, all, I'm glad to talk to you again. God bless, good luck to us all. This is Chatty Dad 1. Never give up your guns, or your rights will go right along with them. And y'all, I hope you're prepared for to have a female president, because that's what's going to happen. It might not be what we all want to happen, but that's what's going to happen. It's been predetermined. It's been preset. I've already seen some stuff on that too. Anyway, God bless, good luck to us all. Chad Dab 1, over and out.